World War II pushed medicine into territory no one had prepared for. Doctors and medics faced catastrophic injuries, scarce supplies, and conditions that demanded creativity far beyond the safety standards of modern healthcare. Some of the practices that emerged were born from desperation, but ended up saving thousands of lives. They were often dangerous, untested, or ethically questionable, useful in the moment but unacceptable by today's standards. Yet understanding them reveals how modern emergency medicine evolved, what wartime improvisation looked like, and why strict medical regulation exists now. Below are 7 practices from World War II that genuinely saved lives, shaped today's medical innovations, and remain banned or heavily restricted because of the risks involved. Frontline medics frequently poured sulfonamide powder straight into open wounds to prevent infection. At the time, this was revolutionary. Infection killed more soldiers than bullets in previous wars. Sulfa drugs were the first widely used antimicrobial agents, but rubbing raw powder directly into tissue caused severe irritation, tissue damage, and sometimes delayed healing. Despite the drawbacks, the practice dramatically reduced battlefield deaths from sepsis. Today, sulfonamides are still used medically, but no clinician is allowed to dump raw pharmaceutical powder into a wound. Modern antibiotics and sterile wound care eliminated the need for such harsh measures, and applying any antimicrobial drug in raw form would violate medical safety regulations. Before the war, blood transfusion protocols were strict. On the battlefield, following them exactly was often impossible. Medics sometimes performed walking blood banks where fellow soldiers donated on the spot with only rudimentary typing, or none at all. If a wounded soldier was dying rapidly from blood loss, the priority became volume replacement over strict compatibility. While often successful, these emergency transfusions brought the risk of transfusion reactions and transmission of diseases that could not be screened at the time. This improvisation contributed to the development of modern blood banking logistics, but unscreened or hastily typed transfusions are illegal today. Every blood product must undergo rigorous testing, storage, and compatibility verification to protect patient safety. World War II medicine saw widespread use of treatments that had barely entered clinical trials. Penicillin, still experimental at the war's start, was administered in massive improvised doses. Morphine syrettes, small preloaded injectors, allowed quick pain relief but risked overdose, contamination, and reuse between soldiers. Other experimental drugs, from anti-malarials to stimulants, were issued because the immediate survival benefits outweighed long-term unknowns. Modern medical law would prohibit giving any unapproved or inadequately tested drug to patients on a large scale. Wartime urgency allowed rules to bend, but today these practices would violate the core ethical standards of informed consent and clinical safety. Severe limb wounds required rapid removal of dead tissue to prevent infection. Battlefield surgeons often performed debridement using only minimal pain control, especially when supplies were low. It was agonizing, risky, and traumatic, but it saved limbs and lives when alternatives, waiting for full surgical support, weren't available. Performing major wound care without proper anesthesia would be illegal and unethical in modern medicine, except under the rarest life-or-death circumstances. Yet World War II soldiers survived countless injuries because medics were forced to act immediately with whatever tools they had. Tourniquets today follow strict guidelines. Width, placement, duration, and pressure are tightly regulated. World War II medics often tore cloth, used belts, or repurposed gear straps as tourniquets. Many of these makeshift devices saved lives by stopping catastrophic bleeding, but they could also cause nerve damage, tissue death, or loss of the limb due to prolonged pressure. Despite their crudeness, these improvised devices laid the groundwork for modern emergency hemorrhage control. Civilian EMS today would never be allowed to use unregulated tourniquets, but the desperation-driven solutions of World War II inspired the purpose-built devices we now rely on. Amputations on the front line were rare, but sometimes necessary to free trapped soldiers or to stop spreading infection. These procedures were performed with minimal sanitation, limited anesthesia, and improvised tools. While harrowing, they prevented certain death from crush injuries or gangrene. Today, an amputation outside a sterile surgical suite is nearly unthinkable in regulated medicine. Field amputations are legally restricted to extremely specific rescue scenarios, and even then they require specialized training, documentation, and equipment. WWII doctors had neither the equipment nor the legal protections, only the necessity. Cigarettes were used to calm soldiers in shock, ease pain, and even sterilize certain equipment with open flame in the field. They were so embedded in battlefield medicine that Red Cross packs and first aid kits occasionally included them. Smoking was believed to steady the nerves during trauma care and was one of the few tools universally available. Today we know the long-term health consequences, and using cigarettes in a medical context would violate nearly every modern health regulation. Yet, in the moment, they helped keep wounded soldiers conscious, cooperative, or at least calmer during emergency care. These banned or restricted practices reveal a truth often forgotten. Medical innovation doesn't begin with perfection. It begins with someone trying to save a life under impossible conditions. WWII forced medicine to evolve at a pace no peacetime system could match. Many breakthroughs were born from risky, unregulated methods that would never be acceptable now, but they paved the way for safer, more effective care. If you want more deep historical dives like this, let me know. There's plenty more hidden history where these came from. Strange history.